I'm Dr. Hassan Galadari. You know who I am.
Ladies. Hi, I'm Dr. Samar, dermatologist in Dubai and in Lebanon.
And I'm Dr. Hassan Galadari, dermatologist in Dubai. And
Welcome to Eucerin Skin Talk.
So it's the month of May, and every time we talk about May, we have to bring up melanoma. So, Dr. Samar, how are you today?
Good, how are you?
I'm very well. So, melanoma. So tell me a little bit more about it.
So melanoma basically develops in the cells that produce melanin, which is the pigment that gives your skin its color. Mm-hmm. So the major risk factor for melanoma is UV radiation, whether it's from the sun or from tanning beds or solarium. But there are definitely other risk factors. So what are other risk factors, Dr. Galadari?
Well, first of all, you have to think about it in terms of genetics. One of the most important things that we have to think about is that do our skin types, does it play a major role when it comes to developing melanoma? Granted that people with fairer skin develop, or have a higher chance to develop melanoma, but at the same time, people also with darker skin types can also develop melanoma.
Yeah.
Yes.
So other risk factors may include, other than fair skin, patients who have blue eyes, patients who have a family history or a personal history of skin cancer, patients who had sunburns during childhood or adolescence. Yes. So it's not just recent exposure, because this is a common misconception among patients. So having a sunburn during your childhood can increase your risk of melanoma later on in life.
Exactly. And did you guys know that around 80% of our sun exposure is developed, before the age of 18? So it's very important to protect ourselves from the sun.
I have a confession.
What's going on?
I used to put tanning oil on my face when I was a teenager.
Okay, see, there you go. At least you've confessed.
Exactly.
You are forgiven, my child.
Thank you. But now, of course, it's sunscreen all day long.
Okay. So apart from sunscreen, in terms that we know that it helps us protect ourselves when it comes to developing, whether problems that will cause melanoma, what other things can we do to help us to kind of abate that problem? So,
of course, besides sunscreen, we recommend that you seek shade, that you wear protective clothing, so long sleeves, pants, a wide-brimmed hat, sunglasses with UV protection. And we also recommend that you reapply your sunscreen, because this is something that, patients tell me, but I put my sunscreen in the morning, but that's not enough. So reapplying is necessary, and putting the right amount of sunscreen as well.
Exactly. And when it comes to doing that, you have to always examine your skin. And, a lot of people will say, what do I have to look for when it comes to seeing things that are changing? So it's very important for us to kind of realize what is it that we're looking for.
Exactly. And in patients with higher risk for melanoma, we do recommend that they visit us, dermatologists, for a regular skin check.
Okay. And so my recommendation here is every person out there have a self-examination on a regular basis. I would say on a weekly basis. That's very, very important. If you have a partner, your partner can also examine your skin, because they can help you do that. And then see us, of course, on a regular basis annually for a skin check.
Exactly.
But what is more important is that what is it that they have to look for?
So basically, they have to look for either a new growth that looks weird or a changing mole. And we all know, or I hope we all know, the ABCDE of melanoma. Yes, can you tell us about it?
I was going to tell you. So you tell me the A, I'll tell you the B.
Okay, so A is the asymmetry. So if you cut the mole in half, both sides should be similar. If they're not, this is a bit worrisome.
And B is for border, and the border has to be on a regular. So it doesn't have to be anything that's irregular or is basically kind of looks a little bit more on the funny side. You also have to kind of think about it differently.
And C is color. It's good to have one color. If there are more, then we would also start to worry.
And then we have D, right? D is diameter. So the diameter basically, though they say is about 6 millimeters, but anything that could be beyond that or a little bit more on the smaller side, you have to be careful in that aspect. But the most important one is E.
Which is evolving, meaning changing. So if you notice that your mole is changing either in size, in shape, in color, you have to visit us.
So I think we kind of summarized melanoma in a nutshell there, Dr. Samar.
Good job.
All right.